Once again, welcome to this session on Ask Me Anything with Dr. Jayanti Thumsi on breast health. Myself, I am Chinmay from Anvay Wellness. A quick intro to what we do. So we are a healthcare social enterprise focused on integrative cancer care and holistic. So we have started preventive care program for women, as well as we have a survivorship program, as well as a cancer care program going on. So currently in the COVID situation, we are facilitating online consults. We are also going to start our studio as soon as this situation stabilizes. We'll have our small studio for cancer care coming up in Bangalore. So that's what we do. About Dr. Jayanti, she's an accomplished, very experienced senior breast oncologist in Bangalore, works out of Sparsh Hospital here, and she is an expert in breast oncology and breast conservation and breast reconstruction surgeries. So I'll stop sharing my screen, and thank you, Dr. Jayanti, to be kind enough for joining us for this session.
Hello.
Yeah.
Hi, myself Sneha Vagela, and I'm a mother of one child, and like my son is now almost 1 year old.
Okay.
And I have two questions. So first, so I have like almost, because he was not really ready to take now breast milk. So almost
Sorry,
around
he was not ready to take what? I did not hear.
Breast milk. So around when he was 10 months old, because he started the solid food. And only one time I was giving him bottle of milk, and now he suddenly, like after 10 months, he almost stopped my breastfeeding. So as you have already suggested that it should be good that I should have at least for 1 year, but somehow I have not seen very eagerness, or like he was not really ready for it. So is it bad, or I'm so sorry?
Yeah, so see, what I'm telling you is that risk reduction, all right? So it doesn't mean that if somebody has not fed for 1 year, will 100% develop cancer. It's not so, okay? By doing that, like I said, exercise regularly, right? There are chances that you will lose weight, but there are a lot of women, in spite of exercise, don't lose weight, right? But chances or the risk is certainly lesser for women who breastfeed for at least 1 year. Now you have done whatever has happened. Don't worry. You do the self-examination regularly, okay? And yes, again, I would like to tell all of you that even while a woman is pregnant and even while she's breastfeeding, you need to do breast self-examination once in a month, okay? During pregnancy and during breastfeeding, there are a lot of changes which occur in the breast. It might be difficult to detect any abnormality in the breast. Nevertheless, please continue to do breast self-examination even during that time. Yeah.
Okay. And any special care that I need to take care if I have stopped now breastfeeding? So
no, that should be okay. But for your own breast health, do a breast self-examination monthly. Yeah.
Okay. And in any stage of that, you have shown us currently that for 1 centimeter, 2 centimeter, that thing, in any stage, we need to remove our breast, or it can be chances only it can be healed. So
no, I told you, right? It is not mandatory that breast has to be removed if somebody develops breast cancer. Without removing the breast, it can be treated. And in some cases where breast has to be removed, we can reconstruct the breast, all right? But if it is detected early, we do not have to remove the whole breast. Without that, we can clear the cancer.
Yeah. Thank you very much.
I think there's a question from Ms. Triveni. You can unmute and ask, madam.
Hello, ma'am.
Yeah.
The size of the breast can be reduced, or how to control it, ma'am?
Yeah, size of the breast, yes. If you reduce your weight, overall body weight, yes, even the size of the breast comes down. Doing some chest exercises may help, all right? Wearing a right kind of a bra helps, all right? A well-fitting bra, especially when you do some exercises like walking or jogging, or you're doing gym, then it's important that you wear a proper sports bra, okay?
Okay.
Yeah, and in spite of that, you feel that the size of the breast is big. There are surgeries available, but surgery is a last resort. We would certainly want you to do all of this, do regular exercise, reduce your body weight. That itself helps a lot in lot of women. Yeah.
Okay, thank you, ma'am.
Okay, next question from Nandita Sachdev, please. Others, please mute. If you have a question, please put it on the chat window. It's easy for me to moderate.
Hello, doctor. I just wanted to ask, does wearing a wired bra on a regular basis has any relationship with breast cancer, or does it do any harm wearing it on a regular basis,
Right.
wired and padded?
Yes, wonderful question, and I'm sure this is relevant to all women. And thank you for coming out with this question. So, what kind of bra you wear is your own choice. All right, you may wear a padded one, unpadded, wired, unwired, black, blue, yellow, white color. A very loose fitting or a tight fitting, is completely your choice. And that has nothing to do with breast cancer. There are no studies that say that one particular kind of bra has a higher risk of producing breast cancer. No. Only thing is, I would like to say that all undergarments, it should be of natural fabric. That is, it should be cotton, because not that the synthetic ones cause cancer, but the synthetic ones do not absorb sweat, So I would recommend that you wear cotton undergarments, but what kind of bra you want to wear, some women do not want to wear it in the night, is completely your choice. And that has got nothing to do with breast cancer.
Thank you, doctor.
Okay, next question from Sharvari Joshi. Please unmute and ask. Okay, okay, her question, I think she has put it on chat, is what extra precautions can be taken by women who are not able to have a child or choose not to have one?
Yeah, so you should understand that the risk is a little higher. However, it does not mean that a person who does not have children will 100% develop cancer. No. Or women who have children will never develop breast cancer. That also is not true. The risk is reduced when a woman has a child, especially less than 30 years of age. All right. So extra precaution is that keep your body weight under check. Like I've already said, eat right, exercise regularly, limit alcohol, stop smoking, and do a regular breast self-examination. Go to a doctor once in 3 years, or if you're above 40, get a mammogram done once in a year. This is exactly what you need to do, as we have already discussed it in the previous slides.
Yeah. Next question from Kirtana. You can go ahead and ask.
Yeah. Ma'am, I could feel some pain in breasts since 2 months, but I have consulted my gynecologist. She suggested the vitamin E tablets for a month.
Yeah.
I could still feel the pain. Like I have been using it since like 20 days. Do you suggest me to go for mammogram, or is it all okay?
Yeah, so pain is a very, very common symptom, and I'm sure most of us experience that during the cycle of the period, especially during periods and before that, breast does get very, very painful. All right, and this pain may be in one particular part of the breast or the entire breast. Sometimes it is on one side of the breast, sometimes it is on both sides of the breast. Yeah, most of the times it is quite harmless. All right, but if in doubt, it is better to do a mammogram if you're above 40 years of age, and if you're less than 40 years of age, do a breast ultrasound. Okay. And if your doctor has already examined, maybe there is no lump, and if there is a lump, they will take it forward. And vitamin E is what I would also agree with. Okay. And in these cases, doing exercise regularly helps. I've seen that.
Okay, can you suggest some exercises to reduce? Because ma'am, this is like since prolonged time it has been for me. I mean, it's not before or after periods, it is throughout the month.
Right, right. In some women, it does happen to. I think just going for a brisk walk every day is good enough. Okay. It's the best form of exercise. 1 hour, the goal is to reach 4 kilometers in 40 minutes. Yeah?
Okay.
Yeah, and if you do it for 1 hour, then maybe 5 kilometers at least in 1 hour.
Okay.
Yeah. Yeah.
Thank you.
Next question from Ms. Archana Anand, if you'd like to ask, or okay. Ms. Archana has asked, please comment on any natural foods that may improve prevention of recurrence of the cancer after surgery.
Yeah, like I already said, eating natural food is very important. So whenever you are choosing to eat something, just think, did my grandmother eat this? So what our grandparents or their parents ate was more in tune with nature. It was more natural food. Eat a lot of vegetables, fruits in your diet, and eat as much as possible homemade food, which has a lot of nutrition. A balanced diet basically is very important. Avoid the junk food, avoid the fast food, avoid the ready to eat food, those drinks, please avoid it. Eat as natural food as possible with a lot of fruits and vegetables in your diet. These have a lot of micronutrients which help in preventing cancer or in preventing recurrence, as in your case.
Okay. So then, ma'am, there's follow-up questions. If chemotherapy is not possible due to age, are quarterly checkups sufficient to detect and effectively combat cancer regrowth and spread? So there is, I think, an elderly patient with a metastatic cancer, which is the case here, and chemotherapy, I think, is not possible because of age.
Yeah. Quarterly is what I would recommend. Once in 3 months. Yes.
Okay.
Yeah.
Okay. Next question from Sudha.
Yeah,
okay.
Good evening, doctor. This is Sudha here. I'm 55 years old. How to prevent to get the breast cancer or any other type of cancer, and how to know in early stages?
Yeah, I think I have already explained all of this.
Yes.
In your case, how to prevent is, like I have repeatedly said, eat right, exercise regularly, have the first child before the age of 30 years, at least breastfeed for 1 year, yeah, and exercise regularly. Do not use any hormone tablets indiscreetly without any doctor's prescription. All right, eat natural food with a lot of fruits and vegetables in your diet. Exercise regularly is what would prevent the disease. All right.
Yeah.
And if you have a strong family history, we can do the genetic test to know if you are really at a high risk or not. All right.
Okay.
And how to detect it early is, when we're talking about risk factors, there are a lot of risk factors which are in our control and which we can do, but there are some risk factors which are really not in our control, right?
Okay.
Now, in such cases, early detection is what is going to help. Early detection, like I said before, you need to do breast self-examination once in a month. And since you are already above 40 years, I would recommend that you do a mammogram test once in a year, all right? Do not wait for symptoms to come and then do a mammogram, all right? Do it as we do a routine health checkup, right? We recommend that you do a routine health checkup once in a year. Similarly, as a part of routine health checkup, do a mammogram once in a year, yeah? And that
Sure,
will help
doctor.
in detecting the disease early.
Sure, doctor. Thank you so much.
Yeah. Question from Manisha is that, do non-cancerous cysts become cancerous in future?
Yeah. So there are the cysts that you're talking about. There are different kinds of cysts available. Most of the cysts do not become cancerous. All right. But yes, there are some cancers which actually present like a cyst. They are cysts to begin with. These are called as complex cysts. So cyst is basically a lump which is filled with fluid. It may be water or any kind of fluid. But the cysts are not sometimes completely filled with fluid. There may be a solid component in it as well, which are called as complex cysts. These are the ones which could become malignant, and hence doing a proper examination, investigation like mammogram, ultrasound of course, and if required, we would do a biopsy, all right, of the cyst to determine whether it is malignant right now or not, or some of them can be even pre-malignant. Pre-malignant means they are the abnormalities which are not malignant right now, but have a very high chance that they could become malignant in the future, all right? But most of the cysts are usually non-cancerous and they can be very easily treated with only medications. Most of the times even surgery is not required.
Okay. So there's another question from Aditi. Do you recommend vegan diet after completion of breast cancer therapy?
Oh, no, I don't say that you should have a vegan diet. That's your choice. I don't even say that you should give up on non-vegetarian food, eat natural food, eat a complete, balanced, wholesome food of your choice, of something that you're used to right in the beginning. I just say that don't use any ready to eat or fast food. Eat natural food. It can mean anything. Yeah.
Okay, I think this is similar question from Neha on types of food. I think you've covered. Another question I think is, does regularity of periods is somehow connected?
Sorry, regularity of?
Periods, is it connected with breast cancer?
No, it isn't. Yeah, though the breast is a organ which is completely in control of the hormones in your body. Yeah, but having irregular periods or does not mean that one develops cancer. No, it has got nothing.
Okay, I just want to add on the question, ma'am. Hello, first of
Yeah,
all,
go
and
ahead.
thank you for a very nice session. My mother has a history of a breast cancer, and I'm 27-year-old now, and we are located in Germany. I got married a year back, and we are planning to have a kid. Let's say, as you said, before 30, the first.
Right.
And do you recommend anything else? Should I take care of you? As you already said, these genetic tests, which I found a very good input.
Yeah.
So I think is these tests are also available outside India, because we are located in Germany now. So,
oh yes, it's available everywhere. In fact, we were earlier not doing it in India. We would send all the samples either to Netherlands or to US. But now there are many labs, very reliable and very good labs available in India. Yes, Germany will have, all right. But the ideal thing would be, if your mother is there, the test should be done on your mother first, because she's already affected, right? So that would be the right thing to do. If do it first on your mother, and in that, if we detect something, then we do it on you. That would be the right thing to do. However, there are families where the person who's affected by the cancer is not alive anymore. If they are not alive, then we do for the rest of the family members. But if the person who had developed cancer is alive, it is best that we do the genetic test first on them, to detect whether they developed it because of any abnormal gene, and if it comes negative in their case, there is no need to do anything for you.
Okay. And will you also please tell me exact name of these tests? What are the genetic tests called? Is it just a normal blood test?
Yes, it's a normal blood test, and it is called as a genetic hereditary panel test. Okay, cancer panel test, and each country would have a different name. But if you say this, they will know what you mean. All right.
Okay.
Yeah.
And one more question which I asked about foods, as we already talked about the natural foods and packed foods.
Yeah.
Here I meant something like vitamins, like selenium or iodine, which is, taken for good working of thyroid glands. Are there certain vitamins which one can take to, prevent these?
Well, I would not recommend any supplementations. All right. Supplementations are to be given for somebody who's not able to eat, right? Because of whatever reason. But if one is able to eat good nutritious food, eating natural food is very important, A balanced diet consists of good amount of proteins, carbohydrates, vegetables and fruits. Yeah. At least 2 servings of vegetables and at least 2 different types of fruits in a day. That covers most of these micronutrients which you have mentioned, selenium and zinc and magnesium, which are all very important. And these are micronutrients because they are needed in our body in very minute quantities, and usually the fruits and vegetables will take care of that, will take care of that. So I wouldn't recommend any supplementation for healthy women. I wouldn't recommend. Unless, like in vegetarians, vitamin B12 deficiency happens, all right? Or vitamin D deficiency happens, because all of us most of the time work within closed spaces, we are not exposed to sun, and so vitamin D may be less. In such cases, if it is less, if it is detected by blood test, then we correct it by giving certain supplements. All right, but not otherwise. If you're already healthy, I wouldn't recommend supplements.
Okay. All right.
Thank you, Neha.
Thank you, ma'am. Yes, thank you.
Question from Rachna T is how being overweight increases the risk of breast cancer?
Very good question.
What is the relation?
What is the relation?
Actually, this is Manjunath here, ma'am. I'm a dietitian. I'm just logged in from my wife's phone.
Right.
So that was my question, how being overweight increases the risk of breast cancers in terms of, is it because it gives you more inflammation in terms of producing the cytokines, or is it any other, according to your, perspective?
Perfect. So yes, what you said is the chances of inflammation are high, and breast cancer is a kind of inflammation of the cells. All right, that is true. But secondly, what is more important is that breast cancer is a cancer which is completely dependent on hormones, especially the estrogen. All right. Now the estrogen is secreted from different parts of the body. One is the major source are the ovaries. All right.
Right. Yeah.
Then there are adrenal glands. All right. And
Right.
then the most important is the body fat. All right. It
Right.
is the body fat which has certain enzymes which can convert the androgens into estrogen. All right.
Right.
And in a woman who is obese, the estrogen availability to the tissue is much, much higher.
Right.
And that can cause cancer. All right. Especially also women who have developed cancer, to prevent the cancer coming back. All right. We
Right.
would recommend that you should have an ideal body weight. All right. So that can cause higher risk of cancer in women who are obese, because they generate estrogen from the body fat. And if more body fat, more estrogen is generated.
Right. So should they avoid, the foods which gives more estrogen, like soya and, these kinds of foods? Should they avoid or eat less in moderate quantities?
So yeah, there are studies, but there is no conclusive study by which I can tell you. There have been trials which have happened, but any conclusive study has not come up which says that eating soya will cause cancer. I'm unable to answer that because there are no concrete studies as yet. These are all postulates. There are many people who are trying to find out, did soya really cause? But I'm unable to answer because there is, like I said, breastfeeding reduces the risk. This is a proven fact. Like that, soya is not yet proven. So I have no idea.
Okay.
Right, ma'am.
Sorry to
Just last
interrupt. I
question.
think, sorry, Mr. Manjunath. I think we had questions from other registrations. I think we need to go there, and we are running out of time. Sorry about this. A question from KR Meera was, my father's sister passed away due to breast cancer. I am 62 years old. What precautions do I need to take?
Yeah, I think I've repeatedly told this. If there is somebody in your family who has developed breast cancer, like I think I answered Neha's question. Similarly, the answer to you, if that person is alive, the best is to do a genetic test on them. If they're not alive, we can do the genetic test on you. Eat right, exercise regularly, do breast self-examination, and if you are above 40 years, do a mammogram yearly is what I would certainly recommend again and again and again.
Okay, another question from Ms. Geeta Bedi. I met with breast cancer in 2019. I think treatment process is completed in 6 months. She has felt some uneasiness in the other breast. USG is done, but it is normal. So
Right.
Any recommendations for her?
Well, you need to do self-examination of the other breast, and I'm sure your doctors will ask you for a regular follow-up. Yeah, and that should help.
Okay, there is another question, how to differentiate between a mole and a cancer sign?
If the mole, many times mole is very docile and it remains of the same size for many, many years. And in such cases, you don't have to worry. But if the mole suddenly starts increasing in size, suddenly the color changes, or it becomes bigger in size, it becomes irregular, yes, then you need to go to a doctor and get yourself examined. Yeah. If you have any doubt, it's best to get yourself examined.
And one last question I think came was that, is there any vaccination available to prevent breast cancer?
Yeah, right. It's a good question. So yes, cervical cancer, there is a vaccine which is already proven. All right. But for breast, it is not yet available. Yeah, but we hear that it is in the process, but it is still a long way ahead.
Okay.
Right now, there is no vaccination for breast cancer.
Okay, great. I think, ma'am, I think we have addressed most of the questions. I think it was a great session. And I think that Dr. Jayanti, thank you for sparing time for us. I think it's been a very informative session.
So thank you very much, and I'm very happy for all the questions that you've asked, and through your questions I'm sure it has helped the other participants as well. All right, so yeah, I would just like to sum up saying that women, please do take care of your health. Your health is extremely important, not only for yourself but to keep your family healthy and to look at it at a bigger perspective to keep the entire society healthy. All right, and our health is finally our responsibility. There are small things that you have to do, like breast self-examination, and that can help you in the long run. And whatever you understood today, please share it with other women in your life. And who knows, because you shared, you might save somebody's life. Yeah. Good luck to all of you, and I wish a very healthy life to all of you.
Yeah. One quick thing. I think Dr. Jayanti is also working with us, and we facilitate online consultations with her because of the COVID situation. But if you have any other follow-on, personalized, more detailed discussions you would like, feel free to reach out to us on this given helpline and email. I will be happy to facilitate these consultations for you. Yeah. So thank you everybody for this participation. And thank you again, Dr. Jayanti. Very nice to have you. It was a